We're back, everybody. If you shy away from the camera during all those holiday photos because you're not feeling good about your appearance, you know, you could give yourself an early gift of a facial or eye lift rejuvenation. Dr. Sam Shatkin Jr. is here from the Aesthetic Associates with details. Nice to have you here.
It's good to be back here.
And I think this is great because you really can give yourself a gift that you'll be so happy with.
I think so. Well, you know, it's a gift that keeps on giving,
yes,
because it's something that you'll experience and enjoy, not just if you're redoing your house, because you're only there at the house and you won't see if you do a facelift there, but if you do a facelift on your body all day long, when you carry that with you, you can see the results and be happy about them. And
we do have some befores and afters because there's always something new out and things that will actually help you get through a procedure like this, make it easier on you, make your results. It will make you so happy. Now here's a really incredible before and after.
First, I want to just comment that some of these pictures are made available by the American Society of Aesthetic Plastic Surgeons, but this is a great example of a woman that just didn't like the tired look, wanted to rejuvenate and look a little bit healthier and fresher. And I'd like to also point out that in my practice, we try to make the appearances look natural. If somebody looks like, you know, Joan Rivers or Phyllis Diller, not that they're not attractive women, but they've had overdone treatments. And that's not what the goal is. The goal is to be natural and freshened and that's what people want, especially in Western Europe.
Now, this woman had a facelift and an eyelid lift, too?
She had eyebrows lifted, upper eyelid, lower eyelid, and a full facelift with the neck. And you can see the contouring and the shaping of the neck as well. And also, most of the patients that we treat with this kind of sun damage need some non-surgical treatments as well to rejuvenate the skin.
Wow. Okay, let's go to the second picture.
Okay.
And here is where...
A little bit younger individual, but also had some change that she wasn't happy with. The lines across her forehead, some of the puffiness underneath her eyes, and that jawline, which starts to get square as we get older, because not only do we get deflated in the cheek area, in the middle of the face, but it all tends to sag down below the jawline. So we're basically rejuvenating by pulling all that back up again and plumping up the face a little bit. That fullness really makes it more youthful.
Well, and it's gravity that's working on us all.
Yeah, and here's that same person from the side view. You can see that extra skin that she's got in the neck.
She looks like her daughter, and she looks like mother and daughter.
Right. It's a very dramatic improvement, and these are natural changes that take the years back. It's not like you're looking like somebody you never looked like. It's just revitalizing to what you might have looked like years earlier.
Wow. And here's another one. This is another interesting,
good example of a jawline that rejuvenated, the eyelids rejuvenated. And you can see all these patients tend to smile a little bit more after the surgery because they're very happy about the way they look. And that's a nice thing. That's what the goal is.
That jawline is the one that gets everybody, between the jawline and the neck.
Right,
There's even a writer who came out with a great book. So I'm sorry, I apologize for my neck. It's the name of the book.
Sorry about my neck.
And it's true, because that really kind of gives you away as far as, I mean, more and more older women are starting to wear turtlenecks for a reason. You know?
Well, I think we try to hide things either with makeup or clothing, but why not just give yourself a chance to show it all off? And that's what I try to encourage with my patients. And I let them tell me what it is that bothers them. And when they look in the mirror, they find spots. Sometimes it's not the whole face, sometimes just the eyes. Sometimes it's just the complexion. And we've done a lot of things, and we've talked about on the air about things we can do to improve the complexion. But sometimes we'll combine all of those together. We'll use the skin treatments in the office, the laser treatments, the chemical peels, and the surgical procedures to get the best overall result.
Right, and you brought something very interesting, because we're always talking about what's new in this industry, and you're even talking about a suture closure.
Well, I've been doing this, well, I just came back. I just came back from the American Society of Plastic Surgeons meeting, which was in Chicago right before Obama was there. But some of the new things, and I've been doing this now for almost a year, we're using these barbed sutures, and the barbed sutures are very interesting because if you can see in this picture, it's got little barbs on there which are in a reverse direction. So what happens is when we're doing tummy surgery or facial surgery, we use these underneath the surface of the skin to bring the edges together, or we'll tighten up the deeper layers, like in the facelift, as like a thread lift, if you will, to bring things up a little bit and bring that volume back into the face. And this is just one of the newer things that's available. Some plastic surgeons use them, some don't. We do in our practice, and I think it's a new innovation.
Just interesting, because now you're actually speed healing the closing from the inside.
Well, the nice thing about it is we're not always relying on surface stitches, which will be that train track look almost. We still have to use them for some circumstances, but many we don't have to. So if we're doing the tummy tuck or the arm lift or breast surgery, we can often use these, and then they don't get that stitch mark, which is sort of nice.
That's great. And of course, let's talk about the fact that you have a great skin line out. for treatment on the skin, whether it's before or after, and this is wonderful.
Well, sure. You know, maybe we can pan down towards the products, but the one thing that I just want to comment on is this. Using these in combination with the skin surgical procedures really will give the best end result.
Yes.
And ultimately, it's not just what you do in the surgical arena, it's what we can do on a daily basis to take care of our skin.
Yes.
And I think it's very, very important that we properly treat our skin with good products.
And you know, everybody, even though this is not our sunny season anymore, you still need a good sunscreen. You'd be surprised how much sun damage you can still get this time of the year.
Yeah, I mean, people all the time ask me what the one best product is to put on your skin. It's a sunblock with a good moisturizer. And people don't think about doing that. But, you know, my brother being a dentist, he encourages people to brush every day. And if you don't brush every day, then going to the doctor once or twice a year is not going to be the answer. So you need to do something to your skin that's on a daily basis. Moisturize it, hydrate it. We can even use exfoliating products, glycolics and things like that, which will exfoliate the skin. And all of those things will be maintenance for our skin so that we'll slow down that aging process so that we won't have to have the surgery sooner, but eventually we probably will because of gravity. And Isaac Newton sort of determined that for us. So we can't change
he
that.
explained it to us. But just think, and maybe it's a genetic thing. Maybe it's I've always hated my blank, you know, whether it's under the arms or it's my neck or it's these eyes or whatever. You don't have to live with it. You can really be pleased with your result and get just the result that you were hoping for or looking for. You don't have to live a lifetime with a feature that you're very unhappy with.
Right.
It's so easy to go in and get a consultation and find out what can be done. And when you find out how simple it is for you as far as your recovery and the time involved, it's just so you're in a very gratifying business for a lot of people.
Well, the patients are very gratified, and I'm very gratified because I know I'm helping individuals, making them feel better and look better. Sometimes it's not such that dramatic change they're looking for, just a subtle change to make them smile a little bit more during the day and feel better about themselves throughout the day. And really, that's what it's all about. And I know, you know, in the dental practice, my brother does the cosmetic dentistry, the combination of the plastic surgery and the dentistry can really make people smile.
Yeah, and you know what? That could be the very best gift you can give someone, or give yourself.
Speaking of that, we also have gift certificates if you want to give something to your loved one for the holidays, or some products that we just talked about.
Yeah.
Those are great gifts for the holidays and good stocking stuffers too.
I agree. I mean, you know, you can give somebody another sweater, but if this is something they've always really wanted or we're concerned about or we're thinking about, this is an opportunity to go on and get a consultation and begin the new year right, the way you want to look, with the Aesthetic Associates Center. Wonderful people located at 2500 Kensington Avenue in Amherst, right there on the corner. Give them a call at 839-1700. Set up your consultation and find that look that you're looking for. It's there for you. It's there. 839-1700. You'll be so happy you did. This segment was brought to you by Dr. Sam Shatkin and the Aesthetic Associates Center, the American Society of Plastic Surgery.